Dr. Otabor, make we appreciate them, please. Yes, sir.
Good morning, Honorary President.
Good morning.
Good morning, everyone.
Thank you for your patience.
Thank you, Honorary President. I've been enjoying myself all along. It's always a great experience being here. You know, because of my busy schedule, I don't really have much time to follow you. But whenever I come here, I always feel relaxed. Thank you.
Yes.
I would like to start by thanking you for personally attending my birthday on 25th December. You know, you were in Kaduna, you came from Kaduna, took that risky road, and you came for the church Thanksgiving service. And you came to the house, you spent about 4 hours just sitting in my sitting room. That's a big honor. Thank you. I'm grateful.
You are a special being.
Thank you, sir.
You have a golden heart.
Thank you.
In fact, no be golden heart. You have a diamond heart. Make we appreciate them.
Thank you. So just a few, before I go to my topic today, which is breast cancer, I made some observations. That young lady that came with 5 kids that said...
My wife?
Yes. In advanced countries, she would immediately get the medical attention she needs.
Okay.
Because, yes, she has what we call...
she get mental problem.
Well, in mental, in quotes, it's called delusional disorders.
Delusional
disorder. So it's a psychiatric situation, and she needs help. So maybe like psychotherapy and all that. Maybe we need to visit her home, find out, you know, what's happening around there, and talk with the family members for her to get the support that she needs. There are different types of delusions. Some would even say they'll see somebody on television and say that person is my boyfriend, but it's just that he doesn't want people to know, and then he can carry that idea for 5 years. You know, that one is erotomania. It's another type of delusional disorder. Some feels that they are bigger than what they are. In fact, that they are the owner of the universe. That's delusion of grandeur. So there are different types. So I don't want you to...
We not go appreciate Dr. Otabor.
So instead of scolding her, let's give her the help that she needs. Then concerning this woman here...
This one.
Yes.
This one where you talk now, just a quick addition. Thank God you have been here. I went out and I saw her sitting there and she was speaking to herself. Yeah. I watched her severally. And
Dr. Otabor.
Yes, sir.
You see this one? I'm not ready to help her. I'm serious. If the madness send her to me to come do this one, the same madness go carry her go somewhere. I know I'm not ready to help.
Okay.
I'm not ready to help.
It's up to you, Ordinary President. But I just wanted to clear the air.
You good as you clear, and yes. You good as I clear myself. Yes. I know they're ready to help her. So continue.
Thank you. For the other woman, she has a very good heart. I mean, with her condition.
Yes.
I like her so much.
Hey.
We do knee replacement in Alliance Hospital for 3 million naira for one. And she says she needs to do the 2. If we examine her and I feel that she needs the knee replacement, I will do the 2 for her for free.
My dear, can you hear me? Can you hear me?
Jesus!
Madam, please. Can you talk to me, ma? Where is your husband?
He's at home.
Do you believe God is capable of handling our problem?
I believe, sir. I believe, sir.
Have you seen it practically?
Yes, sir. Yes, sir. I believe.
What do you have to say to God?
I don't even know what to say. I just want to say thank you, God. I don't know. I don't just know to know. I don't know what to thank God. I don't know what to thank God. I just want to thank him. Thank you. Thank you. Jesus.
Thank you for the opportunity, Ordinary President.
My sister, hold the microphone for her, madam.
Yes, sir.
Madam.
Yes, sir.
Madam.
Yes, sir.
Are you a Christian?
Yes, sir.
Can you remember any chapter or verse of the Holy Bible? Any one that comes to your mind? Which one?
I just remember John 3:16.
John 3:16. Can you talk to us about John 3:16?
Yes. For God so loved the world that he gave his only begotten Son, that whosoever believe in him shall not perish, but have eternal life.
Madam?
Yes, sir.
Me that is asking you to look for a chapter in the Holy Bible here. I am a Muslim. I hope you know that I'm a Muslim.
Yes, sir.
I want you to know that when God remembers you, everything will look miraculous before human beings.
Yes, sir.
This is your time.
Amen.
So please, today, if you can, I want you to praise God in a special way. God did not forget you. No. God allowed you to know those that are truly with you. Some of your friends have left you.
Yes.
Talk to me.
Yes, sir.
Some of your relations are avoiding you now.
Yes, sir.
By the time they see you bouncing on your legs, some of them will shamelessly come back.
Yes, sir.
It is for you to learn the lesson of life. Please don't cry.
Thank you, sir.
You have succeeded in making me cry, but please don't make me cry again.
Yes, sir.
You hear?
I won't. It's not that I'm crying, but it's just the tears of joy. Sir, you will not understand.
Yeah.
But it's just God.
Don't worry.
Thank you very much,
We
sir.
will talk after the program. Dr. Otabor.
Thank you, sir.
Over to you, excuse me.
Okay. So today, I want to talk about breast cancer. Last year, I noticed a lot of people, women, died from breast. Those that I know, about 20 women that died from breast cancer, and a good number of them should have been alive if they did the right thing if they discover the cancer early and if they got the right treatment on time. So because of that, when you gave me the opportunity, you said, when are we going to talk about something on health? I thought of breast cancer. I remembered my sisters, my aunties, our mothers and all that. Breast cancer is a big problem all over the world. About 200, and it's estimated that in 2020 alone, 285,000 women died from breast cancer around the world. That means that since we have been in this place, over the last 3 hours, about 100 women have already died from breast cancer. It's that common. And in Nigeria, about 12,000 women die from breast cancer every year. That means at least about 35 women die every day from breast cancer. Is that big? So it's a major disease. And so what is the breast cancer? It's an abnormal growth of the cells within the breast. And it affects both men and women. It's just that the incidence among women is far more. In men, about less than 10% or less, maybe 1%, depending on the environment.
So man, they get breast cancer.
Yes, man gets. When I was doing my postgraduate training, we managed like 3 men that had breast cancer, and they actually still die from breast cancer. Yes, so it's not a disease of women alone. Men also have breast cancer. And in terms of age, breast cancer is not common, is not present below puberty. But as soon as women get into puberty and the hormones start working on their breast and the breast bud starts coming up, they are prone. But it's also not common less than 30. Though we are seeing breast cancer in younger people now in Nigeria, in the developing world. But usually it's from 40 years and above that you have the incidence being high. And the peak period will be between 50 and 70 years. That's when people suffer more frequently. It's said that the lifetime risk of a woman to get breast cancer is 1 in 8. That means 1 in every 8 women would likely get breast cancer in their lifetime. So that's quite a huge number.
How can we prevent it, sir?
Okay, so I'll talk about people ask about what causes this breast cancer.
Thank you.
There's no clear cause. There's no definite cause
Of breast cancer.
but there are risk factors, and that's important. The first risk factor of having breast cancer is the fact that you are a woman. Once you are born a woman, your lifetime risk factor is 1 in 8. That means 1 in 8 women. Then increasing age. We don't fear about breast cancer in younger women. But once people start getting into their 4th decade, 5th decade in life, then the risk of having breast cancer increases. Then the age at menarche. Menarche means the first menstrual flow in a woman. If a woman starts menstruating very early, let's say less than 12 years of age, then she has a higher risk of having breast cancer in life compared to women who started menstruating from 14, 15 and above. It's a risk factor. It doesn't mean it will be so. Then the age at menopause. If women get to menopause much later in life, they are at higher risk of getting breast cancer than those who have menopause earlier. Then family history is one of the strongest. If a first-degree relative dies of breast cancer or was diagnosed with breast cancer, let's say mother, auntie, then the chance of that person, that woman, getting breast cancer is very high. Then for nulliparous women who did not have who have never been pregnant, their risk of having breast cancer is higher.
What do you call them?
Nulliparous.
Okay.
I mean, those who have never been pregnant, their risk of having getting breast cancer is higher than women who have had babies. And then for some women who have reached menopause and they now started using hormone replacement therapy to treat side effects of menopause, they have a higher incidence of breast cancer among them. Then other breast conditions. Last month, a woman came to me and said she had this lump in her breast for many years and she didn't do anything about it. And by the time I was seeing her, I took her to the theater to just take a little tissue for test, and it came out to be cancer. So she neglected what was there before. So previous conditions of the breast can predispose to breast cancer. Then obesity. Women who are obese, fat women, they have higher risk. And then those who eat a lot of fatty food and those who take alcohol. These are risk factors. But a lot of women still have breast cancer even without falling into any of these risk factors. That means they are not necessarily sacrosanct. But if you can work on these risk factors and if they can be modified, it can reduce the risk of having breast cancer. So how do you diagnose it? When a woman comes to us in the clinic, how do we know that she has breast cancer? She will say, I have a lump in my breast. Some women are able to feel the lump.
Now, for those of now where they hear the word lump for the first time, swelling, something will go be like say
na canal or something.
It swells small inside, and if you they touch them, it go they feel different. Like say it's strong, like say it's soft.
Exactly.
Now be a lump.
It's different from the normal breast tissue. Then sometimes what you just have is a dimple. They'll just like the skin is puckered, as if the skin go inside. Just that small sign, as innocent looking as it is, it can be a sign of breast cancer. Then some people, the skin on the breast looks like orange. We call it peeled orange. You have those small holes, dimples on the skin, like as if it's orange skin. That is a dangerous sign. It could be a sign of breast cancer. Then sometimes the nipple, instead of coming out, would retract. It will go inside. That's if it has not always been so and it now happens like that, that can be a sign. Then there may be swelling in the armpits due to lymph node spread. So when we want to make a diagnosis, we take a history and then we examine the patient. We examine the breast, not just the one that they complained about, we also examine the other one, and we examine the armpit. We also examine other parts of the body, because in Nigeria, over 80% of women who come with breast cancer come in when they're already late. That means stage 3 or stage 4.
Over 80%.
Yes. It's already late and there's little that can be done to prolong the life. But in advanced countries, people come in with stage 1, stage 2. Those are early diseases that when you do something, they can be cured. But in Nigeria, because of late presentations, mortality is very high. So we want to check everywhere, check the liver, check the lymph nodes to make sure that it has not spread. Then we ask for some tests, including CT scan, and ultrasound, and then we need to do a biopsy. Before you can make a diagnosis of breast cancer, you must take a tissue from that breast and look at it under the microscope. That will tell the behavior of the cells, and it can confirm the cancer. After you have confirmed that you staged the disease, you see a woman complain of problem in the breast, you will be wondering, why is the doctor doing CT scan of the brain? Why is he doing CT scan of the liver? Because we want to check whether it has spread to those areas.
Okay.
Yes, that's the reason for those. So if it has spread, the treatment is different. If it has not spread, the treatment is different. So what's the goal of treatment? It depends on the stage. There are some that you want to attain, you want to aim at cure when the disease is very early. But when patients come late, you can't cure. You have to just do palliative care. Most of the time, the breast will need to be taken out
completely.
Yes, depends on if it is very small and it's early disease, we can remove that part of the breast and do irradiation, radiotherapy. That then we monitor the patient. But if it is big and it has advanced, you want to take out the breast. I remember 5 years ago, a young lady came to meet me, very close. We were close. We diagnosed. I was the first person to see her, and I said, "Look, this looks like breast cancer." I took a tissue, sent it for test, and it came out to be breast cancer. I told her that we need to take out your breast. She said, "Doctor, my breast is the most lovely part of my body. I'm not going to allow that." Unfortunately, she got involved with some people who say they can do natural therapy.
Traditional.
Not even traditional. There's this one that is not even traditional now. Is they hang around the internet. They will tell you all sort of garbage. Pawpaw leaf, you boil it, you add it with watermelon seed, you do lettuce, you do carrot, mix everything and drinks. She went underground and was doing all those crap. 1 year after, I think 1.5 years after, by the time she came out, the breast, the surgery, the cancer was inoperable. So even if you do the surgery, it's not going to add any value. And she died the 3rd year. Yes,
It became a helpless case.
Yes, it became a helpless case, and we lost her. Very close person to me. So, quick decision making is important because yes, it's a difficult decision to say, you know what, I submit myself for you to take out my breast. But if that will save life, then it's worth doing. Because with current plastic surgery now, we even give women a finer breast than the one that we removed. Yes, yes, breast reconstruction surgery.
Good to hear. Good to hear.
So there's no worry about okay, so there are different types of treatment.
So finer.
Yes,
right.
finer.
Yes. Okay.
Yes. We have surgery, we have chemotherapy, we have radiotherapy. After surgery, some of the cells would have escaped from the breast and they are traveling to the liver, they are traveling to the brain. So chemotherapy will help address that. And then after surgery too, sometimes you may need to use radiotherapy to address the floor, the area, just to make sure that we are safe, because recurrence is very high. Recurrence means after you have removed the breast, even on that same chest, the cancer can still come back again, on the chest wall. That's why we go all the hog to do all those things. So, and it's also good to counsel patients, adequately so that they know what they are involved with. Once anybody is diagnosed of cancer, it's a fight for life. And many people win the fight with good counsel and with good motivation. But why others may not be fortunate to win.
Yes, sir.
So in terms of prevention, we need to create awareness, and that's part of what we are doing now. Women must know their bodies, and when they stand before the mirror every morning to look at themselves, they must observe differences. Is there a difference between the right and the left breast? If there is it that when you lift your hands up, for instance, is there something that seems to be holding back one of the breasts? Is there a swelling? Is there redness? Is the nipple the same? All those things are very important. If you notice any change, run to the hospital. Then breast self-examination. It's been said over and over. We cannot emphasize it enough. For women to examine their breast every morning. It doesn't cost anything. Just before you take your bath, you check, touch everywhere to make sure there's no swelling or no lump anywhere. You use the right hand to do the left breast, use the left hand to do the right breast.
Can a husband assist his wife?
If he's not very busy, yes.
No,
but
at night.
But this is not joke.
I'm not joking.
No, I'm talking. It is safer. It is more assured for the
woman to do it herself.
Yes, because the man will be doing something else.
Oh, okay.
We can't trust what the man's intention will be.
Okay.
But the woman will check it by herself.
Doctor.
So the woman will check it, go around, to make sure nothing strange is there. It's called breast self-examination. And then for people who that we also talk about annual medical check. Every year for women above 30 is advisable for them to do mammography, okay, or ultrasound. But mammography is more useful for above 40, really. But ultrasound, breast ultrasound can be done, you know, and if there's any little thing can be picked up. Most of the problems you will find with the breast will not be cancer. But it is advisable to address it because some of them can eventually transform to be cancer.
Yes, sir.
So with all this, you know, we will be able to reduce the burden. So if we didn't take anything away from this discussion, we should realize that breast cancer is common and it can show up anywhere. And secondly, if we are observant about our bodies and we notice changes, we should immediately show up in the hospital. And we don't have to wait for changes. There is screening exercise for breast cancer, for mammography and breast ultrasound. For people above 35, just make sure once in a year you go show yourself to the doctor. The doctor may even, it's said that the doctor's clinical examination of the breast is even superior to the one the patient does by herself. Then she can ask for breast ultrasound for people who still have lumpy breasts, you know, younger women, and then mammography for the older women. And with that, we can reduce the incidence. And if we pick them early, we can still save lives.
Can a woman decide that a male doctor will not examine her and insist on a female doctor, sir?
Yeah, that's within her right, but
because it is very important.
We are talking serious business here.
I am also talking serious business.
If she has the privilege, like for instance, in Nigeria, the doctor-patient ratio is very high. I mean, the patient-doctor ratio. There are some local government. Forget the fact that we're in Abuja. There are some local government. There's only one doctor
in the whole of local government,
and it's a man. Does it mean that the woman be selective? It will harm her health. So why I don't want to encourage this.
I am not protesting. I'm only asking a question.
Yeah, no, it is within her rights to say, look, I will only allow a female doctor to see me as a female. But if that is encouraged, people would rather go without being cared for because they are holding on to something we think is not so relevant.
Okay, thank you, sir.
Thank you.
Doctor, I beg give us phone number because after the program now, they go begin, they call me. I no be doctor. Give us phone number where you go fit attend to people, sir.
So, but I would also like for people to ask one or two questions. If
okay. I go make I first give them number.
Okay, sir.
You don't know what they suffer anytime where you come. Person go come in, ordinary president. That thing where Dr. Otabor talk in the studio, yes. Okay, what if you take no?
Okay, so I can give the hospital number.
Okay, sir.
Yeah, if they want to see a doctor, they can now come and we'll attend to them. 081 734. No, you taught me how to call it. 081 73 48 09 09.
Calm down. Talk am again.
Okay. 081 73 48 09 09.
For the last time, repeat them.
081 73 48 09 09.
That na Alliance Hospital phone number. Yes. Thank you very much.
Thank you, President.
Anybody will get a question, ask. Okay, my daughter won't ask question. Come. Sit down near doctor. Oh yeah, sit down.
Good morning, our ordinary president.
Good morning.
Good morning, Rekete family.
I want to ask, once mucus color is coming out from a woman's bust, doesn't mean she has breast cancer. And if a teenager has a breast cancer which she hasn't given birth and they do the surgery, how can she breastfeed her child when she gives birth?
Okay.
Thank you for the question.
Thank you. You can go back.
Okay, first of all, nipple discharge is one of the signs of breast cancer. I don't know. I sent some pictures to the media room.
Okay.
I don't know if they have.
Some of these pictures
Yeah.
cannot be used on the internet.
Okay.
They feel sanction us.
Oh, that's fine. Okay, so nipple discharge is one of the.
But wait, made a sanction. For the purpose of education, show if they ban us, we create another forum. Show the.
Okay, so that's an example of a breast cancer. You see how it has damaged on the left side of the breast and the axilla, the armpit. That's cancer spreading to the armpit. It's not a good side. Okay.
Next one.
Okay, see, that's a nipple that has gone inside. Instead of being out, it has retracted.
Because of cancer.
Because of cancer. So just seeing that alone, the first suspicion will be cancer. Yes. But if women don't know, they think, oh, it's just a normal thing. But if you see something like this, start running to the hospital.
Okay, next one, please.
Okay, so that's a discharge from the nipple. You can also see some.
And she's not pregnant.
Yeah, she's not pregnant. There's some reddish sign and blood around there. That's a sign of breast cancer.
Next.
Okay, so this is the orange skin appearance that I talked about. It's called peel d'orange because of the blockage of the lymphatic drainage. So the fluid is not coming out, so it's swelling up on the breast. So that's this sign. If you see it on the breast, the breast is swollen with this kind of puckered, areas on the skin. It's a dangerous sign.
Okay, sir.
Yes.
Next, please.
Okay, I think that should be all.
Thank you.
So to answer the young lady's question,
Yes.
Nipple discharge can be a sign of breast cancer, but it is not anything to worry about in young people who are teenagers, because breast cancer is extremely rare, if not unknown, in people in their teenage years. Hormonal imbalance is the commonest cause of nipple discharge, where you find adult women who have nipple discharge and they are not pregnant, and no pregnancy, around them. It could be a sign. It could be a sign of some tumor in the brain, around the pituitary gland, because breast milk production is a hormonal thing. The brain signals the breast, and the breast produces the milk. But breast cancer can manifest as nipple discharge. Then she talked about if a teenager has breast cancer, if they remove the breast. Well, to start with, a teenager is not likely to have breast cancer. And if for any reason anybody has breast cancer and is still within reproductive age, most likely the two breasts will not be taken out at once.
So one
can still serve. But if the two for any reason is taken out,
life goes on.
Yes, alternative means of taking care of the baby would be explored.
Thank you. Yeah. Thank you very much. We don't they educated? Yes. Okay, Barrister Ogo. After you give to my sign language lady.
Thank you, my ordinary president, for this opportunity. I bet me una no vex for this my question. Now waiting people they talk like those where the internet where doctor they talk. I hear say if husband or children drink breast milk, the person no go get breast cancer. Not
okay,
true.
so it's a myth. There are a lot of fallacies.
Waiting be myth.
Okay, that means a story will not be correct. Yes, I agree. The breast of a woman belongs to three of them: the husband, the baby, and herself.
Okay,
and there's a competition. Yes, but if the husband chooses to, have the milk of the woman, it doesn't change anything. And that stands to reason. It doesn't in any way remove the risk of the woman
she
having.
they try to talk be say any breast within they suck the milk come out, no, they get cancer.
That is not even correct.
No, I want to know whether husband or children sucking a woman's breast can reduce the risk.
It does not reduce.
Cancer. Okay, sir.
It doesn't reduce. Yes.
You good, as you tell him. My sister there, tell him.
Good morning, Brekete family. Okay, so you advise that every morning we should use the mirror, check our breast. So I want to ask, when a woman is in her flow, the size of breast changes. So I don't know if it's advisable for us to still check our breasts around that period.
Yes, you should. If the size of breast is going to change, both of them should change equally.
Okay.
Yes. If you are having lumpiness during menstrual flow or during the different stages in the menstrual cycle, hormones work on the breast and it brings about changes in the breast in preparation for pregnancy and delivery. If one of the breast has become heavy, the other one should be heavy. If there's a change in shape, it will affect the two. You understand? So that is not a problem, and it's a temporary thing because it will come back within, as the cycle changes.
Okay.
Yes.
Thank you very much. With this, okay, Chef Fatima,
okay.
You are the last person.
Good morning, sir. My question is, for example, now you discover some women forcefully remove their baby from breast. They wean them, yes. So, but within that period, you discover that the breast is lumpy for like over a week, and it's so painful. Please, what is the effect of that on the woman?
So the breast is engorged because the breast, is a reflex. Production of milk is a reflex, and that process has already started. So if the baby suckle on the breast, the baby extracts the milk. But if you stop it suddenly, the breast milk is still being produced, but it's not coming out. So there will be engorgement. That's what is happening. That is completely different from...
Does it increase the chances of cancer?
No, it doesn't increase the chances of cancer.
Okay, sir.
So after some time, once what is helping the breast milk to be producing is the suckling effect. As long as the baby has stopped suckling, the reflex that will be producing the milk will be cut off. After a few days, the breast milk will stop. But as long as the baby is still suckling, breast milk will continue to be produced even for years.
Okay, sir.
Yes, but that interval between when the baby stops suckling and when the breast milk stops, there will be engorgement of the breast. But after a few days, it will subside and everything will come back to normal.
Thank you very much. Make we appreciate Dr. Otabor. With this one way Dr. Otabor educate us, make we allow him, make you go back to hospital. Make we appreciate
Thank you, Honorary President.